Anxiety is the single biggest driver for unhappy reactive pets. Waiting for the other shoe to fall, dogs can scan for threats, startle with even small household noises, and if they panic when they're left home alone, well, they can damage your house and your good friendship too. And in fact, some of them have been known to get defensive just because of anxiety. In case we haven't met, I'm veterinarian Dr. Jeff Nickel, along with our family border collie, Miss America here. I don't know if you can see her. She's flopped over on her side, and this is Tony, and this is Gaston. And I'm residency trained in veterinary behavior medicine. Been in practice for a long time, more years in general medicine actually. I completed my residency about 5 years ago. So now I have a practice exclusively for behavior disorders of dogs and cats. Well, if you can hear me, please hit the wow button just so that I know I'm coming through and there are no technical difficulties. And if you find this information helpful, please hit the heart button so I know I'm being valuable. And if there's anybody you know who has an anxious pet, they may learn something, so put their name, tag them in the comment line. And in fact, tell me that you're here and tell me where you're from. I'm always happy to greet people who I probably met before on our Facebook Live events. So I'd like to start out with a little story here. Well, these cats snack here. This is a case I saw just 3 years ago now. Older couple, senior citizens, Jim and Mary. And they had a guy, 2-year-old male neutered pit bull, actually a very nice dog, named Howie. Except Howie had his behavior issues. And we always start with asking people, okay, what's the problem that's concerning you? And they sometimes believe that they actually have the diagnosis already. Wonderful. Thank you for the hearts. But what they really have is symptoms, and that's an important distinction. So here are the problems that Howie came in with. Getting on the furniture, shouldn't be that big a deal. Digging in the yard, normal behavior actually, although we can steer them to do it in the right place. Excessive barking, well, okay, that's pretty common, right? Still can be a problem. And chasing shadows, and that got my attention right away. So here's the history on this guy, Howie. On leash walks, he would always be watching other dogs, even from a distance. He was fixated on them, and if the other dog walker spoke to his person as they passed, Howie would immediately lunge at the other dog and bark and growl and lunge and snap. That's not healthy, okay? It was also, he was reactive to every dog he saw. There were no exceptions. And when he was at home, he was okay, pretty calm, except when one of his people, Jim or Mary, stood. And then he started to get immediately agitated, routinely. And when Mary would stand in the kitchen at the counter, he made it a point of kind of weaving and maneuvering around her legs, kind of drove her a little crazy. And, with a person her age, it could have been a tripping hazard. And that's an indicator. And Twyla, thank you so much for coming. And I'm so glad you're learning something helpful. Even if your dog doesn't have this exact problem, you may come away with something, I hope, that's useful. Or if, again, you know somebody, by all means, tag them. And if you have a dog like this, by all means, tell me. Oh, and got my puppy in 3 weeks. Ooh, that is so exciting. So remember, when you get that little rascal, start those vaccinations 6 or 8 weeks of age. Keep them up to date about every 3 weeks, and immediately during that time, as young as possible, start that puppy in a puppy socialization class. They can learn a few basics like come and sit, but the whole point is to get exposed to other dogs, other puppies, other people, gentle handling. And you think, oh gee, where will I find one of those classes during, stay-at-home restrictions? I get it, and that can be an important problem. So get together with friends at their yard, stay 6 feet apart, wear masks, and let those puppies just enjoy each other with adult dogs and other people. Gentle handling, all manner of different people of different descriptions and other dogs, because that sensitive window between 5 and 12 weeks for puppies is all about setting them up for a lifetime of success. Because cases like Howie here, who reacts to so many other dogs, and this is anxiety driven in his case, some of these things are genetically programmed, but environmental influences are huge, or missed opportunities to provide the right environmental influences at the right time. So 5 to 12 weeks of age. And don't let any general practicing veterinarian, I was in general practice for many years, I know everybody in New Mexico almost, and I'm not dumping on them, but I'm telling you that they're not necessarily clear that these vaccines, they're not bulletproof, but they're mighty close. And the downside of not properly socializing a puppy between 5 and 12 weeks is a lifetime of struggle, and the risk, we've got big research showing that if puppies are all up to date on their vaccines during puppy socialization classes, nobody ever gets sick. So it's a extremely small gamble, totally worth taking. Oh, Cindy, hello. Thank you for coming. Great to see you. So, all right. So here we got Howie, and you know, he's reactive to just when his people stand up. And many dogs are like that, not necessarily with their own people, but visitors typically, because if it's anxiety and discomfort around unfamiliar people, but they're sitting, well, we're not that mobile when we're sitting, and we appear smaller to the dog, and so we are less of a perceived threat. And very often when a guest has been sitting and then stands up, dogs will react. And it's so easy to follow the impulse to reprimand the dog. Say, hey, you stop that. I don't want that lunging and growling. Well, of course you don't. But the problem with dogs, they're different. And they don't understand when you tell them what not to do. They believe that every response from their leader is an earned reinforcer for what they were doing, and in fact what their emotional state was of that moment. So if you don't like a behavior, you absolutely must totally ignore it. So if you're with a dog, if you have your dog with you and you're concerned that it might react, keep it on a leash so you can ignore and create distance, or take the dog to another room. Okay? So back to Howie. Here was the thing that one of the things that really got my attention was he had a very consistent habit of chasing shadows. For example, at night, if some car passed their house and the headlights came through or there was a shadow on the wall, he always chased it. And to test that, they took out a flashlight and shined it on the wall, and sure enough, he did that. And there are people who think, oh, this is entertaining. This is a pretty unhealthy sign. It can become a compulsive behavior, and that is, well, in humans, that's a genuine mental illness. Well, it is in dogs too. In Howie's case, what it turned out to be was what we call a displacement behavior. He lives inside a house surrounded by a fence like any responsibly cared for dog, right? But they can't do what they would like to do if they're really anxious and nervous, which is get the heck out of there sometimes. And so they redirect their behavior in a different way. And so in Howie's case, he did it with chasing shadows. And he was restless, especially at night, and hyper alert, which made it hard for Jim and Mary to sleep. Well, that's a real problem. Okay? So, my list of diagnoses, he had a generalized anxiety disorder, started out with an anxiety tendency, probably genetically wired because we have very strong, robust research to indicate how that happens. And then he developed an anxiety association with a growing list of contexts. And boy, when you start to see that happen, you need to get that dog help right now. You know, some of these, I'll talk about some natural remedies, some non-medication approaches, which can be very helpful. But if you have a severe problem, you should see a veterinary behaviorist or a veterinarian who has some special training in behavior medicine, because the severe cases need medication. It should not be a last resort, and I'll talk about that a little bit now. It's just one more tool that we have that we can use safely and effectively, as long as we have a doctor who's well versed in those things. So he also lacked what we call an adequate opportunity to engage in normal canine behaviors. So we'll talk about what we did about that. And he had some barrier frustration because dogs don't understand leashes. Believe it or not, doesn't matter how many miles they log on a leash, it's just not something that they're hardwired to recognize. If they're getting communication from their leader on the other end, it can be a useful tool, but many of them simply get frustrated because they don't really understand it. They should be able to get involved and interact with those other dogs. So, he's an energetic, highly social dog. So I wanted them to get this dog a lot more exercise. Now you'll hear people say, oh, this dog's behavior will go away if you give him plenty of exercise. Well, there are a few things like that, but for the most part, a lot more exercise is a very important thing, but it's one component among many things that we integrate with a dog who has a behavior disorder like significant anxiety. So I told Jim and Mary to take Howie out off-leash, to off-leash dog parks, to run and horse around with the other dogs. I could also leave him in a doggy daycare service. Ideally, Howie would do this every single day of the week. We know that with all that physical exertion, there is release of the neurotransmitter serotonin from the muscles, and that reduces anxiety. They also release endorphins, and they get what in people we call the runner's high. That happens in dogs too. So naturally, we can diminish their anxiety simply by giving them a lot more exercise. Again, just one component for Howie here, but a mighty important one. Now, the light chasing, I wanted them to get him involved in a different behavioral response. And so what I had them do at times of day when he might otherwise do that was withhold his food, so he was food motivated prior to the sun going down and him getting agitated by lights, and then feed him from food dispensing toys and puzzles like a twist and treat. I've shown these things before. Lots of other kinds of food toys. That's just one of many. And then that issue with his with the leash. Sometimes you can quit the leash walks and simply go to the dog park or the doggy daycare every day. Gets the dog's needs met, and you can walk laps around the dog park if you want to. Okay. So I also told them that I wanted them to give him a routine. Anxiety, by its definition, is an illogical, unfounded worry about what might be lurking around that next corner. And the opposite of anxiety is predictability. So if Howie knew that events would happen in the same order for him at about the same times of day, then he would have a great deal less to worry about, and it'd be much healthier for him. And I gotta tell you that the thing that makes, to me, behavior medicine, all of veterinary medicine, but behavior medicine in particular, so valuable to me is how it brings out the best in these pet parents. Because it takes a special kind of empathy to recognize the differences in members of another species. They have a lot in common with us, and that's why they, my cats, now gentlemen, you could come up. Carolyn, would you give me another indoor hunting feeder here loaded, because these cats aren't keeping me company up here. Darn it, I think they make pretty good landscaping for our friends who are sharing this event with us. And I'll give you this other one, thank you. And here, I'll give you this other one too. You can maybe load them both up, thank you. All right, here, there you go, yes, no. So, so one thing I did with this little guy was I put him on a natural supplement called Angstine. It has something called L-theanine in it. And let me show it to you. I'm going to turn the camera around. There we go. And they have Angstine S and Angstine ML. This is for small dogs and cats. And then they have it for bigger dogs. It's given twice a day. And it has a plant amino acid called L-theanine. And it has well-established anti-anxiety effects. You don't need a prescription. What we like about it, you're dumping food on the floor there, Gaston. What we like about it is that there's no side effects, there's no risk, but there's a flip side, and that is that because it's a natural supplement and it can be helpful, it is not highly potent. So if you have a severe anxiety disorder like Howie did, you might need medication. And in fact, in addition to the Angstine, I ended up prescribing for him, and they work well together. And so it helped, and he did much better. So I wanted to just tell you a little bit more about the signs of anxiety, and I had a question here. Oh, this is from Deborah. Oh, hi, Deborah. I have a 1.5-year-old mini Australian Shepherd. We are having trouble boarding her overnight. We have boarded her twice, once at the breeder and once at a facility. She was so anxious that she got sick both times. Oh boy, don't you hate to see that happen? And we're not medication-friendly psychotics. Any help for her? She's had lots of professional training, and our veterinarian recommended you. Okay, well, good. Like I said, I'm pretty well known because I'm the only veterinary behaviorist in the whole state of New Mexico. But let me talk to you about a little bit more of these possible treatments, and they might have some value, and you can give them a try. And by the way, don't try at-home methods, do-it-yourself stuff very long. I'll tell you why. Is we know, again, we've got not only great research, but we nowadays have modern brain imaging methods like fMRIs and PET scans, and we can measure growing size of the fear center, the amygdala in the brain. When a pet or a person, and they've done this in lab animals too, experience a great deal of repetitive ramp-ups in anxiety, then the brain is what's called a plastic organ, meaning that it actually changes anatomically and neurochemically. And when you allow a lot more of this rehearsal of these ramp-ups, then these structures actually get bigger, and they get faster, and the behavior, the response gets stronger, and we're going down the wrong direction at a good clip. And we want to put an end to this stuff and dial it back. So if you don't see pretty good improvement fairly quickly with some of these things we'll talk about in a few minutes, then you need to see a veterinary behaviorist, which in New Mexico is yours truly. So anyway, signs of anxiety, the kinds of stuff you should be watching for. Miss America is panting because it's so darn hot here right now. Right, girlfriend? Some dogs, when they're perfectly cool and relaxed, if they're anxious, they will pant and they'll pace. And some of them will bark and cry. Some of them pester their person, which is, by the way, is not healthy canine behavior. But on the other hand, some of them, when they get really badly frightened, such as during storms, fireworks, 4th of July, some of them during their person is absent, they're gone for the day, and if you use a surveillance camera, you'll see it's very individual. And some of them will just hunker down and get small. But you see differences compared with their normal relaxed behavior, and what it's telling you is that that dog is not enjoying a good quality of life. That dog's well-being is suffering. And we love our pets, and we want to do something about that. So let me read you a few excerpts from a paper here. Very brief stuff. I'm not going to load you with a lot of researchy stuff, but this is the Journal of Veterinary Behavior. This is for specialists in my field. This is got really very recent research papers on what's new and interesting. Thank you, Carolyn. And sometimes it's researchy, and it's useful for me and people in my specialty to understand it, but this is quite practical. And this is called, the title of this paper is The Preliminary Assessment of Differences in, hold on, wrong paper, there it is, Comparison of Serum Brain-Derived Neurotrophic Factor. This is something produced in the brain. It's a neurochemical, brain-derived neurotrophic factor, BDNF. And it's responsible for multiple things, including stimulating the production of new replacement nerve cells, neurons. And bad things happen when this neurochemical BDNF is diminished. And very good things happen when it's in greater amounts. So let me just read you a few passages here. BDNF influences learning and memory formation, not just triggering the production of more nerve cells. Learning and memory formation. So if we're low in BDNF, we're not going to learn as well, and we're not going to retain memories as well. And by the way, this is based on research in humans and in dogs and in lab rats. So the brain functions are pretty similar across species in this way. It is prevalent in the limbic region, which includes the amygdala, the fear center of the brain back here, and the prefrontal cortex, which are key areas in the brain related to the regulation of mood, emotion, and cognition. Cognition, our ability to think, make decisions, and respond appropriately. Again, dogs, cats, people, horses, lab rats, that's basic function of this area of the brain. So levels of BDNF are increased by exercise, an antioxidant diet, and we're hearing more about that these days, and we should, and an environment that has been socially and physically enriched, such as what I suggested to Jim and Mary about taking Howie to doggy daycare or to the dog park. Get out there and be a dog. Don't just stay at home in a truncated, limited life, okay? Studies in rodents and humans have demonstrated that stress decreases BDNF in the hippocampus and the prefrontal cortex. Hippocampus, of course, does a lot of different things. Primarily, that's long-term memory storage. So if we have prolonged stress, we're going to have less BDNF, and that's going to cause decreased BDNF in the long-term memory storage and our ability to think and make decisions. It plays a critical role of antidepressant responses. So in other words, and the gist of this paper is that when they gave antidepressants to people with severe depression issues, they found that their BDNF levels came back up into the normal range where they had been below normal, meaning that when they're less depressed, they not only feel better, but they're able to think better and learn better and retain memories better. And we know the same is true in dogs because that's the essence of this paper. So I'm not really making a great pitch here for medication for everybody by any stretch. What I'm telling you is that we need to do whatever it takes to diminish anxiety, which is related to depression in many cases, including in pets. It is not just so that they'll feel better and so that we'll feel better when we're around them, and that matters, but it improves their well-being and their ability to be who they are, to enjoy life, and to respond better. And for example, with Howie, think about whether what he sees when he's with his people, are those real threats, those other dogs, or could we take a second and think about it and maybe respond appropriately? Well, if he's not so darn anxious, he can actually think better. And we see that in clinical medicine all the time. And so I guess what I want you to take away from this thing is that we can do whatever it takes. You can try a variety of things. You can use the Angstitane. There's a lot of talk these days about CBD oil. I'm not going to dump on that either because we have no reason to say that it doesn't help. We just don't yet have good peer-reviewed published research on it. That's underway. We don't know how to dose it. We don't know where the purified forms come from. We don't know if it would interact with other medications. I don't mean just behavior medications. There's a great deal of unknowns, and so as an ethical practitioner, I'm certainly not going to recommend it, but many pet parents have said yes, they've used it, and they've seen some improvement. So far our observation is that it's not super potent for severe problems, but some people have found it helpful. Here's one that I'm a big believer in. This is melatonin, which is actually a hormone. You can get this at any drugstore. You can get it online. Melatonin, of course. All right, wait a minute. I'm turning things around all over the place. Sorry about that. Most of us know it's used to help people reset their sleep-wake, day-night cycle so they can sleep better. It also has anti-anxiety effects. And in certain cases, it's appropriate for use in the morning, not just at bedtime. But it is one of my first go-tos for dogs who are restless at night. And in fact, I ended up recommending it to Mary and Jim for Howie, just to help the poor guy get to bed and reestablish a routine. Remember, we talked to them very seriously about a structure every day of activities, and this is when we eat, this is when we give a food toy, when we might otherwise get nervous and reactive, and this is what we do every day, and the dog could rely on it, and they get into this rhythm, and a good night's sleep is a mighty important part of that. Okay, so there are pheromone treatments too. Here's a good one for cats. This is called Feel Away. This particular one is called Feel Away Classic. This is a calming pheromone for cats. They also make Feel Away Multicat. Feel Away looks like this. It's a plug-in diffuser. You just plug this into a wall outlet and you screw this little refill into the bottom of it, and it diffuses into the air, and it can be very helpful. Now again, many people hope that when they do this kind of stuff, they've got a severe problem and this is going to fix it. No, it's not going to fix a severe problem. Most often in clinical behavior practice, it's one of those things that we bring in among other things that we use to custom fit our behavior modification, behavior management for the pet. This is a pheromone collar for dogs. This also comes in a diffuser. I really like it as a collar. It looks a lot like a flea collar. And of course it goes with the dog wherever she or he goes, and it can be quite helpful. So if you've got a dog with mild anxiety, an adaptable collar can be very helpful. Angstitane can be helpful, and you can use this stuff together. So it's actually pretty good. Here's something that's new, and I want to tell you a little bit more about it. This is called the Khamar Canine, and this is not a medication. It's not taken orally, but it is worn, if you will. Let's see, where the heck? There we go, Khamar Canine. Okay. Anyway, the Khamar Canine is a targeted pulse electromagnetic field device, and it is something that it looks just like this. It's got this loop shape, sorry, wrong word, halo. Loop is something else. This shape to it. And there's a little vest you can get, very comfortable, and there's a little Velcro patch here, and you stick it to the vest, and it sits right behind the fear center of the dog's brain, the amygdala, and you use it for twice daily 15-minute sessions. There's no sensation coming from it. Your dog can snuggle up next to you in the morning and again in the evening, and it's proven to be quite effective against anxiety. It affects the inner function of what's called the microglia, the nerve cells in the amygdala of the brain, and it binds calcium to calmodulin, and you get nitric oxide. And the beauty of that stuff is that it diminishes pro-inflammatory mediators and enhances the anti-inflammatory mediators, reduces inflammation in the amygdala, and it functions more like it should. And as a side benefit, it bumps up the production of other neurotransmitters like serotonin and dopamine, a couple of the feel-good neurotransmitters, and endorphins, you know, like the runner's high. And this is not something you just use on a difficult day. The Khamar Canine is something that you use daily. It takes about 4 to 6 weeks in most cases to become effective. But for just about any kind of anxiety, it's very helpful. Now, it's approved by the FDA only for separation anxiety in dogs. But there have been lots of reports of dogs with other manifestations of anxiety where it's been really quite valuable. And you don't need a veterinarian's prescription. You can go to their website. It's Khamar, C-A-L-M-E-R, the letter K, the number 9.com, KhamarK9.com. And you can order one of these things along with a vest. And we have found them to be very helpful. And they can be used with medications in those situations or some of these supplements we've discussed. And they've been quite valuable. So I just want you to know, though, that whatever we do to treat anxiety, we use generous doses of empathy, meaning that we walk a mile in the other pet's moccasins, don't we? We say, look, I don't understand your language completely, but I'm watching for the signs, and I'm noticing that in some situations you're behaving a little differently than you do when you're calm. And that may mean you've got an anxious pet. And you can learn more about this, by the way, on my website, drjeffnicol.com, drjeff, N-I-C-H-O-L.com. And it's a searchable website, so you can put like anxiety in there. And you'll see all manner of things I've written about anxiety, videos I've done on it, that sort of thing. But reactive behavior, but sometimes dogs who withdraw are equally anxious. Dogs who can become defensive. Please don't punish that. Let's get that thing understood and managed completely. And then so, you know, we're empathic and we treat the pet with kindness. And we know that we feel better when we do that. And when we feel better, we actually can serve as examples of peace and hope to those around us in our life, other people. And I'll tell you what, in times like this, with the problems we have in our society right now, anybody who's out there just feeling hopeful and peaceful, that can make a difference, and that can spread. And it can start with you and your pet, even though they're not human. Maybe because they're not human, because they're different. So empathy, kindness, let's use that in generous doses. We'll start with that, and we'll do that throughout. So, anybody else has a question? Let me see, was there anything else? I don't think so. you can get, I do these things every week to bring out the best in pets and their people. And I also write a media blog. It's actually a newspaper, a question-answer column that's in the Albuquerque Journal every Friday. And if you go to my website, drjeffnicol.com, you can subscribe. It's right at the bottom of the homepage. Costs nothing. And when you do, every Tuesday morning, you'll get my Facebook Live from the week before, and you will get this media blog, this question-answer, which oftentimes can be helpful. I do it on dogs and cats. I do it on behavioral problems and other physical issues. Just about everything under the sun, I get all the questions. And so you can ask me questions if you want to go to my Facebook page, which you already know how to get to. And when you do subscribe, by the way, I will send you at no charge my at-home pet first aid and CPR guide, which is worth printing out and sticking to the fridge or keeping it handy, just in case. So thanks for sharing a little bit of time with me, and thank you for caring for your pets. I know I'm preaching to the choir when I say be kind and empathic, because if you weren't that way, you probably wouldn't be a pet parent to begin with. I think we pet parents are a pretty good group of folks, but there's always so much more to be learned, and we can always do a good job, and we can always bring out the best in our pets and bring out the best in ourselves. So thank you again, and have a great end of the week, and I'll see everybody next Thursday.